take this
No,
responsibility.
Okay, if you select me, or if you tell
No,
me, I can...
but that depends on whether you have acquaintances with each and everyone. I have that one, so I can comfortably handle
most of them.
Most of them. Okay.
Because I know Professor Mitro, Pradeep Mitro very well. Professor Siddiqui I know. Subrajyoti Bhaumik I know.
We have Dr. Sujit Korpurokasto. He also joined. And I invited, I think they are supposed to join, Dr. Rajendra Pandey. Acha, unake ami phone korechilam. He agreed to join, but till now he has not joined.
No, actually, jodi ekta phone call hoyto bhule
geche.
Actually, I also personally can talk to him. Actually, he has agreed.
Prem Kumar, তুমি পান্ডে স্যারের কাছে লিংক পাঠাওনি? ডক্টর রাজেন্দ্র পান্ডে।
It has been sent, sir.
না, আপনার ইমেলে আছে ওটা। আরেকবার পাঠাও, লিংক পাঠাও, ইমিডিয়েটলি পাঠাও। ডক্টর রাজেন্দ্র পান্ডের ইমেলে লিংক পাঠিয়ে দাও। He has not yet received any link.
Yes, sir.
পাঠিয়ে দাও একবার। পাঠিয়ে দিয়ে আবার কন্টাক্ট করে নাও ওনাকে। ফোন নাম্বার আছে? পান্ডে সাহেব ফোন নাম্বার আছে?
I have sent, sir.
হ্যাঁ, ওর ফোন নাম্বার আছে? ওনার ফোন নাম্বার তোমার কাছে আছে?
So Dr. Korpurokasto has joined properly. So he is visible.
Yeah.
Welcome, sir.
Dr. Korpurokasto, Sujit Korpurokasto, noted medical personality in medical research. He has joined. So already I introduced with Professor Siddiqui. Professor Siddiqui is also a very noted medical researcher he is Vice Chancellor of Islamic University of Science and Technology, Kashmir, with whom we have academic collaboration and partnership. And we are waiting for Dr. Rajendra Pandey. He is Honorable Vice Chancellor of our State Health University. So he is supposed to join, and Director of present Director of Medical Education, Dr. Debasis Bhattacharya, is also supposed to join. প্রদীপদা বলেছিলেন তো নাকি ওনাকে একবার?
হ্যাঁ, ও দেবাশিস তো আমাদের কমিটিতে আছে, আমাদের ষড়যন্ত্র তো বলেছিল বোধহয়।
তার একবার বলে দিই।
নাম্বার আছে আপনার?
হ্যাঁ, আমি বলে দিচ্ছি। করে দাও। ডক্টর শরণেন্দু চক্রবর্তীকে রিয়ে করে দাও, কারণ দেবাশিস ভট্টাচার্যকে ফোন করতে হবে একবার। শরণেন্দু চক্রবর্তীকে প্যানেলে ঢুকিয়ে দাও।
Yes, sir. Send the email, sir.
আচ্ছা, ডক্টর পান্ডেকে পাঠিয়ে দিয়েছো?
Yes, sir. I have sent it, sir.
Okay. So, Professor Chakraborty, kindly start.
Okay.
Professor Chakraborty, kindly start.
Very good evening to all the dignitaries. Our Honorable Vice Chancellor, not only honorable, is a dynamic and with full vision and dreams. It is a very auspicious day that our university, under his guidance and leadership, is going to start the program in digital health. And I am welcoming on behalf of the university all the dignitaries, Professor Pradeep Mitro, Professor Siddiqui, Professor Pranta Chakraborty, Dr. Subrajyoti Bhaumik, Dr. Sujit Karpurkasto, Professor Rajendra Pandey, who is the Vice Chancellor of Health University, West Bengal. And more or less, each and everyone knows everybody. And with your help and your generous hands, which you will extend to our university, I think that we will sail in this subject. And with this, I am welcoming all of you as our advisor and professional brothers in our university to establish our team from illusion to reality, this digital health center, which will be started. Most probably, this is the first time in West Bengal we're going to have the day when we are going to establish this digital health center with your kind blessings and generous hands. With this, I request our Honorable Vice Chancellor to speak on this issue. And please, sir.
Thank you, Professor Pranabis Chakraborty. Indeed, it's a glorious occasion and as well as auspicious occasion, as because we could assemble galaxies of these giants in their fields, particularly in the field of medical researches, to support our endeavor in establishing a center for digital health, as mandated by us during our last academic council, for effective collaboration and networking of engineering research and medical research at this state, probably for the first time. And we are very happy that responding to our call, noted personalities in medical researches from this state, they joined us. Amongst them, I'm thankful to Dr. Pradeep Mitra. He is a widely respected personality in this field. Then Dr. Sujit Karpurkasto, another noted personality in the field of medical research. Dr. Pranta Chakraborty, very brilliant researchers in medical science. And we have with us the present Director of Medical Education. He is supposed to join, Dr. Debasis Bhattacharya. And Honorable Vice Chancellor of Health University, he has agreed to join. Maybe due to some technical problems, their joining has been delayed. But I am sure that he will be joining. Dr. Rajendra Pandey, and with us, my dearest, this colleague and partner and collaborator in academic pursuits, Professor Mustaq Ahmed Siddiqui. Is a man of, this vast knowledge in medical and in biological and medical researches. And we had lots of interaction between us in different occasions. And I'm deeply impressed with his, this prudence and knowledge. And the idea behind this is establishing the centers and inauguration of the centers today, as because today is the glorious independence, 74th Independence Day of India. At the same time, today this National Health Mission probably has been declared by our central government. And in line with that, we are also trying to set up our activities here at the state. And we had numbers of webinars being organized in this direction previously, and to generate more vibes and more enthusiasm among the researchers. And basically this will be these researchers engaging our scholars from engineering and technology backgrounds in the field of information science, engineering science, and allied areas with medical researchers, pharmaceutical researchers. And with that purpose, we have engaged one of our director, or two of our directors, Professor Pranabis Chakraborty. He has a background and well-respected personality in pharmaceutical science. And our own another director, Dr. Shivamay Dasgupta, a background in electronics research and electronic science. And we will have more numbers of these personalities in this, particularly this expertise in researches in machine learning and data science and electronic science and other areas, robotics and other areas as well. And for augmenting the process, to make this process more successful, Professor Pranto Chakraborty, he is here. He has presented this many facets of this digital health in previous webinars, and it was an exciting phenomena, exciting, all these lectures that created lots of enthusiasms amongst our participants. And I personally witnessed all these things. And he has this deep knowledge and understandings in this area. Dr. Subrajyoti Bhaumik is a young researcher, and of course, with the support and help of us and guidance from noted persons like Pradip Mitra, Dr. Rajendra Pandey, Dr. Debasis Bhattacharya, Dr. Mustaq Siddiqui, we are confident that we will be taking these these efforts in the positive direction within the shortest possible time. And right now we have from our side, we loosely designed certain mandates and certain future activities for these centers. Probably Dr. Pranto Chakraborty can elaborate further in that direction. We will have your opinions. We will try to we'll make ourselves more illuminated from this radiance of your knowledge and wisdoms and prudence at today's discussions. And we will try to build up a structured framework or structured mandate for these centers, and we will try to work in that direction, following that path, that chalk down path, and we'll formally engage different personalities, different researchers to make these centers very, very effective and very, very useful for this pursuit of all this intermixings or interdisciplinary researches in medical science and engineering science, which was hitherto not available at this state. And this is the right time to take up these activities. That was unanimously decided by us at many occasions, many meetings, many get-togethers. So without spending much time from my side, I would like to request our experts, particularly let us start with Professor Shivamay Dasgupta. He is the man behind our all these activities. Basically, he has a passion and fascination for biomedical engineering. He can speak something like what he is in his mind. Then we will move to other experts and other panelists, and then we will listen to them. And everything will be noted and recorded. And afterwards, this is the curtain raiser session for inauguration of these programs. As we are doing everything is virtually. Afterwards, when the situation will be a little bit normal, we have planned to organize a meeting at our Short Lake office, where we have decided to establish the center formally, and we will look into the aspects of putting up different infrastructure and facility, whatever will be required for this purpose there. And after the situation gets a little bit normal, then we will take up all this activity. Right now, virtually, all this planning, all this this initial groundwork, warming up, all these things, let's all these things be happen. And then maybe within this year, when the situation will be a little bit normal, we will have physical meeting to make these things this really this effective and make this thing really happening. But until that period, our activities will be on these virtual platforms in a periodic basis to keep the pace and tempo of our enthusiasm. And this is our expectations. And let us have certain level of targets after these mandates and all these things been identified, that within 6 months, within 1 year, within 2 years, what we will be doing, that milestones and all these things. And let us make this successful with jointly with support of each and everyone. It will be a collaborative effort, and let us work in that direction. Thank you everyone for responding to our call and sparing your valuable times to join us. And my request to our technical support team, Professor Prem Kumar, to kindly contact with Dr. Rajendra Pandey and Dr. Debasis Bhattacharya further and let Dr. Sharadindu Chakraborty to be in the panel, so that we can have more diverse opinion and this comprehensive views from different perspective and different angles. Thank you.
Thank you, sir.
Thank you.
Shubham, bolo.
Thank you, sir, for your nice introduction, and welcome to all the dignitaries and all the participants. I think this is this was a very sought after project or sought after issue, event, because there was a need for the state to have such a center where engineers and medical personalities can come together and do research and other related activities for the development of digital technologies for medical science. Already, world has moved quite far in implementing digital technologies in various ways, pertaining to the field of medical science. But in our country, we have taken newer steps, but we are still lagging a little behind many of the developed nations. But I think we have to speed up, and there is nothing which can prevent us, because we have so many qualified researchers and I think talents, and I think within a very short time we'll make a significant progress. And in this state, the state has been very advanced, as you know, in medical science, and also now in a new way. I think all the medical colleges are got renovated, and the infrastructure also got enhanced, and we have a large number of government as well as private medical institutions in the state, and also in many of our universities, including our own Maulana Abul Kalam Azad University of Technology, researchers have started working in the fields related to medical science, and digital health is now very important, and all the people have understood that. But what we needed was a platform to come together and do the work together. In our university, we have done a little bit of things actually, but what is needed now, it is needed that more efforts are to be given. And in case of pandemic, this digital technology in health has become more important, because we have now restrictions of meeting people physically or going to the laboratory physically. So in that case, and even doctors have problems of checking all the patients, and patients have problems of coming over to the cities where medical facility is available. So in that case, digital technology is perhaps the only solution, and we have to enhance it. Already, people have started it in this state itself, and we had a large number of webinars in this regard. But that is only the starting, and we have to work further. And so I once again today we have a very galaxy of experts, and who will be speaking on different aspects of digital technologies and how we can go about this center. So we are fortunate that so many people extraordinary people have come in spite of their very busy schedule, and so we will get a real, I think, direction that in which we should move ahead, and what will be our focus of this center, and how we can do much more meaningful and much more, I think, useful work for the people of the state and also people of the country in general. So today I thank all the people who have joined here in the panel, as well as participants, and with all of us, and also many more people who could not join today and who will be joining later on in the center. So for all of them, I have warm welcome, and I wish that we will move ahead with lot of, I think, enthusiastic, endeavor. And I sincerely thank our Honorable Vice Chancellor for making such a center. And really, we have a wonderful thing to go ahead. With that, once again, thanking everybody, I would end my speech. Thank you very much.
Thank you, Professor Dashgupta, for your illustrative depiction. Now, may I request Professor Siddiqui to throw some light. And in this connection, when Professor Siddiqui told about Professor Gachwat, sir, when you were working in the experimental medicine, I was a scholar in Jadavpur University. I had a lot of works with Professor Gachwat. We were interacting more or less every fortnight. And afterwards, my respected and beloved teacher, Professor Amar Bhaduri, became the director, academic. You can remember. And now I'll request Professor Siddiqui to throw some light in our inauguration.
Thank you, Dr. Chakraborty, for reminding me of my days in an Institute of Experimental Medicine and my association with Professor Bachawat and Dr. Sarulia, who at that time, who was also working, Sarulia was also working that time. Let me first congratulate the MAKAUT for starting such a program at their university. And I'm sure we will learn from their experiences, and we will also have a center in the university that I'm heading at this point of time. Actually, being a medical scientist by myself, I was thrilled when I last year learned about the Government of India's initiative to make the digital ID health platform. Last year, when we didn't have a COVID, I was a little bit apprehensive about the countries like India, which are not as open in the sense of shifting from conventional to digital, which are slightly conservative in its approach when we imbibe technologies. So COVID and these technologies, like we call them as disruptive technologies, they together make a very nice story for India or a country like India. So two things have happened. One is that we already have disruptive technologies in our hand. We have IT technology, which is not only now limited to actually making the apps. We have huge influence of artificial intelligence in healthcare. We have data mining. We have so many other technologies which are available. So second is, which is not a good thing that has happened, that is the COVID has come during this year, but COVID has also thrown big challenges to the community like us. And COVID plus these disruptive technologies will make us very, 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 I would say conducive to shift to the newer technologies. So therefore, when last year Union Health Minister said that it will be a platform which will be a kind of a journey of an individual through the healthcare programs. So it will also include the Ayushman Bharat. It will include the Nikshay. Nikshay changed the whole paradigm of the tuberculosis treatment. If we didn't have the nutritional supplements to the tuberculosis affected people, they were not getting the good response to the anti-tuberculosis treatment. So therefore, Nikshay is also a wonderful program, and Ayushman Bharat in itself is a very good program. Then you have a wonderful, reproductive health program which is available. So therefore, if all these things can be clubbed into a kind of a, the health digital ID card, it will make the treatment, rather first the diagnosis and the treatment very easy for the clinical professionals in the field. So therefore, I feel as a person who has worked in this field for a longer time, for almost 3.5 decades, I feel these are very good initiatives. And at the same time, as I said, COVID will compel us to adopt these technologies because of the virtual platforms that we are on, and because of the limited, visits to the clinical OPDs or clinical offices of the doctors. So therefore, it will make us very, very, I would say, proactive in adopting these technologies. There are a lot of issues that are happening this time in the world. In fact, one of my projects in the university is to use the artificial intelligence for reading the MRI pictures of the lung cancers. And I'm told by the scientist there who is working on the project, he has a project which is in collaboration with radiologists of one of the best hospitals of the Jammu and Kashmir. And he tells me, I have improved the diagnosis to more than what a normal radiologist would do it. So he has actually improved it by more 10%. So therefore, there are a lot of technologies that are available. So if we have this digital health ID card of a patient and have all data which comes from the early childhood of vaccination till the death, probably my clinical doctors who are on the panel will appreciate how easy it will be for them to find a problem, find a diagnosis, find an etiology of the symptoms that a patient comes with in their clinics. Many a times, what happens is that the symptoms come today, and it is actually the symptom of a disease is being expressed almost 5 years or 6 years earlier. And that time, whatever the biochemical reports or the scanning reports or the radiological reports, they are not available to the clinician. So he's not able to correlate the present symptoms with the old disease. So therefore, I believe it's a wonderful initiative by Government of India. And the job of people like us and Professor Moitra is how we make it accessible to people, how easy it will be accessible to common man, doctor, even a common patient, how he can actually be a partner in this program. Another point that I'm actually going to talk about is the security of the data, which is very important. You might have heard recently, we had an app called as Arogya, which was used for the COVID. So there are hackers which are called as ethical hackers. I think many people know about it. There are ethical hackers who are not hackers by profession, but they hack it to the extent to show to the developer of the app that you are vulnerable to this and this hacking at this stage. So there were ethical hackers from Sweden which could actually pinpoint to the Government of India that the Arogya is vulnerable to hacking. So therefore my worry is that the data that we generate from this health ID platform, digital ID, health ID platform, it should be very secure and safe. And probably where Professor Moitra's and my role comes there. That is where our academic people who are working in the field, they have to ensure that this data is secure. And then once the data is secure, the individual feels he has a credibility with the organization which develops this app. So therefore, I should have a faith and the trust in the secure system that we are going to generate. So probably it's a really what I would call the interdisciplinary science, where both medical professionals and the technological professionals, which are especially in the field of the computer sciences, artificial intelligence, data mining, they have to work together to develop a robust technology so that this platform, this digital health initiative is a success. It doesn't fall short of difficulties which will make it a failure. So my My best wishes to Professor Moitra and his team at the MAKAUT. And of course, my best wishes to my own team in the university. We are already working in this direction. Actually, long back when I was still working in my field, we realized it, in 2011 or 2012, we realized that what we can, I mean, at that point, I'm going to give an example how important it is. It's very difficult for a patient to find a right kind of a doctor for his disease, And it takes him rounds of at least 3 to 4 clinicians before ultimately he ends up in the right kind of a doctor. So we developed, and we did not develop an app that time, but we developed a system in my institute where we coordinated to make a software platform in which patient was actually putting up his data, and we would generate for him whether it is a neurological problem, whether it's a cardiological problem, because a common man who lives in a very far-flung area, who is uneducated, he actually does not differentiate between a cardiologist and a neurologist, between a cardiac surgeon and a cardiologist, between a similarly neurosurgeon and a neurologist. So therefore, I found, when we applied this software, that time we would call it as a software or a process, it helped a majority of the patients who came from far-flung areas. So therefore, now that since 2012, 2013, we have moved quite a far in developing technologies. Nowadays, we have apps, and the apps are able to, detect many things. So therefore, I feel there is a good, I would say, future for this digital platform, and our efforts in this direction should be very productive. Thank you very much. Thanks to all the people who are on this platform this time, and I'm looking forward to listening to more professional lectures by the experts. Thank you very much to MAKAUT and its Honorable Vice Chancellor and his team for inviting me on this platform.
Thank you. I have an announcement. We have 2 more very distinguished personalities with us right now. They have joined. One is Dr. Debasis Bhattacharya, the Director of Medical Education for the state of West Bengal. Welcome. Welcome, sir, Dr. Bhattacharya.
Thank you, sir.
And
we have and all my best wishes.
Thank you. And just now we listened to Professor Siddiqui. He is Vice Chancellor of Islamic University of Science and Technology, Kashmir. He is our partner in this academic endeavors. And we have another noted personality, Dr. Rajendra Pandey, who has joined. He is the Honorable Vice Chancellor of West Bengal Health University. And Dr. Pandey, can you turn on your video so that we can see you and Dr. Pandey, can you hear us?
Pandey sir, hello. Sir, please unmute your mic. Yes, sir.
Dr. Pandey, welcome. Welcome. Good evening.
Please unmute.
Unmute your mic.
Okay, no, I have got it. Thank you.
Yeah, okay, thank you for joining. Thank you for joining. Probably you know other faces. Only I would like to introduce you to Dr. Siddiqui, who is the Honorable Vice Chancellor of Islamic University of Science and Technology, Kashmir.
And I heard sir talking.
Yeah. Thank you for joining. So now let us move to our next speaker. Dr. Pramavesh Chakraborty, kindly take this session forward.
I am grateful to Professor Siddiqui with your deliberation. You have given the total data in which manner you are progressing in research and academics. Certainly, we will be getting your advice and gracious presence in different occasions in our university for developing this digital health center. Thank you, sir. Now, may I request Dr. Rajendra Pandey. Already our Honorable Vice Chancellor has given the introduction of Professor Pandey. Professor Pandey is not only a doctor, an academician, he is now the academic administrator of Health University, is the Vice Chancellor, Honorable Vice Chancellor of Health University of West Bengal. Sir, we are really glad in your presence, and I request you on behalf of the university to throw some light in our this auspicious occasion of opening inauguration of the Digital Health Center by MAKAUT. Sir, please.
Thank you for the kind introduction. There are certain things which is to our understanding that at the national level, probably we'll have an hospital informatic management system and a laboratory information management system, which will ultimately be linked to make a doctor accessible to their data related to a patient through unique health ID. But the concern is that we need to stratify that these interaction would be of different type. Means one, a health worker who is not a doctor, but would be visiting patients or citizens to retrieve data about their health status and training them appropriately for these data collection and putting it. The second would be that a patient who has become a patient, a normal citizen with some symptoms, as Dr. Siddiqui said, seeking the right doctor. So the first interaction with a basic doctor to find out about the problem and then reaching out to the appropriate person. The third level would be where a junior level doctor who is attending a patient needs to consult a senior doctor. And these interfaces are required, which needs to be very rapid, so that when he's consulting in office and the trouble, go on and get the advice before he can give the right prescription to the patient. So probably when we are designing and developing these platforms, it will become very essential. The other concern is that while if most of the platforms become digital in terms of reporting and accessing medical advice, a greater concern will come to health education. And there also the need would be there that the people who are being trained can access to these digital data for training, and training our educationists would also be a challenge, which is very important. And there we need, because that would require at three levels. One is the basic education level, which will be imparting to MBBS, where doctor might be, other than surgical cases, might be giving consultation to the patient digitally, and then to incorporate that for training would be a challenge. Second is again at the postgraduate and higher level, where it may not be that much of a challenge, where physical interaction would be mandatory. But so far as upgrading the knowledge is concerned, there would be three aspects. One, also from the health personnel who are not doctors, they also need to have an access to archives where most of the information has to be made available to them, so that they will not disturb the medical personnel, including into their time, like say nutritional aspects, the first aid aspects, where to send the patient, or all these things where they may not be interfered and can be categorized. The second aspect is that the most of the materials, because we know that as a lot of medical colleges are coming up, we do not have enough well-trained teachers to cater to this. So archiving the lectures made by proficient people and making it accessible to students, and then keeping interactive time for the questions arising out of their system. That would be another challenge with this digital platform has to do. The second aspect should be that for upgradation of our knowledge with this COVID challenge, if we can go for this continuous medical education through the digital platform, if while you are developing this software, probably a close interaction is needed so that these challenges can be overcome. Thank you.
Sir, please unmute, sir. Pranav sir, please unmute.
Thank you.
Thank you, Professor Pandey, from your objective reality depiction. And certainly we expect and we have the hope that you will be extending all types of helps from your side, and the center will be one of the pathfinder in the digital health. Thank you, sir. Now, may I request, sir,
Sure, thank you.
now may I request Professor Debasis Bhattacharya, the present Director of Medical Education, to throw some light on this digital health center.
Yeah. Good evening.
Very
This
good
drill
evening.
is required these days because of COVID. People are not coming to the hospitals, and if this platform is made properly, it can be utilized very well. As Professor Siddiqui and Professor Pandey has already highlighted, the patients sometimes do not know which doctor to reach. Earlier also, when they were reaching us, that also is a problem, when to get a real right doctor. Because if the doctor himself is not very clear what he is doing and what he is serving, the problem will still continue. So we should be very, very clear in our mind what we are suggesting and how we are guiding people. Second thing, regarding medical education, this is a very good platform. Only thing, the feelings and the sensation what a teacher really gives to the students sometimes do lack in video conferencing and e-learning. But people will get used to it in this manner. And this can be carried over. But truly speaking, in medical education field, still the Gurumukhi Vidya, what we call, is still there. And there lies the difference. Sometimes the soft skills is difficult to be taught to the students through video conferencing. So this is the two areas where we may improve ourselves to go ahead with it. And thereby, we may develop some techniques where these soft skills may be inculcated to the juniors, and also we can grow together. I think it is this much I can tell at this moment. Later on, as it progresses, we may add up and tell something else. Thank you.
Sir, please unmute, sir. Pranav sir, please unmute your mic.
Thank you, sir. You have given the real picture of contradiction. What we are doing today for the COVID-19, the objective reality, and in which manner we are till date, we were educating our students. So let us hope for the best, that the blending will work tomorrow, and we will have a nice center where the people can get their original advantages through this center with your gracious help. Thank you, sir. Now, may I request the academician, administrator, and real stalwart Professor Dr. Pradeep Mitro to throw your total idea so that we can further progress by taking all the dignitaries and your personal interest in this center. Sir, please. Unmute. Sir, unmute.
Unmute করুন প্রদীপ দা।
আনমিউট করেছি তো।
হ্যাঁ, এখন হলো।
ও এখন হলো। আচ্ছা। Oh, anyway, thank you. Already, actually, I have become part and parcel of this MAKAUT, whatever may be. because these the all thinking process since beginning, at least I can say since inception, I was there, and we had a lot of meetings, and there we have decided to start this particular area. And ultimately today, our Honorable Prime Minister has launched the Digital Health Program, National Digital Health Mission. So naturally, we were there, and we are very much into it. So now the question of starting the department functioning, today is the best day for the inauguration. I thank you, our Honorable Vice Chancellor, Moitro, Dr. Moitro, for the beautiful selecting this particular day, and all inviting all our dignitaries, and our Honorable Vice Chancellor, the University of Health Science, and Dr. Siddiqui also has given a nice presentation. Thing is that actually what COVID does, COVID pushes our digital health was there in piecemeal, but COVID actually pushes us to a little bit forward to immediately adopt the digital health, because we have no other options. So now we will have to, jump into the proper functioning of the digital health from all the aspects. Digital health actually, it encompasses a big areas, not only it means electronic data, it keeping the mobile health, telemedicines. As I am a pathology and hematology people, we are already doing the telepathology consultation, but just sending the micro photographs from the microscope, we are sending that to the other side, telepathology, and we are getting the reports or comments from the seniors that or a more experienced persons that we are doing. But these are to be integrated. So integrated in the health management, in the integrated health management system, these all should be integrated. So that's the challenge. So that's the challenge. And already health service is there. We cannot introduce digital health right on the moment by totally leaving aside already prevailing the health service which is there. But it will bridge the gap in the present health service already, and gradually it will take up its place. So naturally, we will have to do that. I have already given some in one webinar series arranged by MAKAUT that administrative bottlenecks in the implementation of the digital health. So I discussed their number of points. Just to tell few of points from there, that administrative bottlenecks, already Professor Pandey has highlighted one area, that all these data are to be, captured by some field people who are not actually doctors. So field workers or health workers who are not actually doctors. So in that level, proper input of the data is very important. So they need some training before that. And also, previously in our medical science, what was their bedside practice? That we used to see the patients by going to the bedside. So digital health also can make us to be present in the bedside by some technological tools. So we can listen to the heart sounds directly by placing some mechanisms in the patient's body. And we can transfer the sounds digitally, and ultimately from remote area we can we can hear that. So naturally, we'll have to improvise on that. Second is that electronic health records, EHR, is one of the key points in the digital health. And already our Honorable Prime Minister already today said that one unique ID card will be health ID card, and in that ID card, all the data will be kept. And Professor Siddiqui also told that any past history, which is very important in our day-to-day medical practice, proper history, past illness, and how he was treated then, and what were the biochemical, changes in our body then it may not be pertinent at that time, but now, after 2 or 3 years, when the patient presents with such and such symptoms, we can go back to review that reports, and we can those reports which were not properly interpreted in that situation of patient's condition may be pertinent now. So that's why all these electronic health records and access is very important. Now, definitely, Professor Siddiqui, what he has told that privacy and security is an important factor for the digital health implementation. So that's why government, our national government also has thought of it, and they have formed National Digital Health Administrator, NDHA. So naturally, that particular branch will look after all these issues of privacy, security, all these disclaimers, everything related to legal side. Everything will be taken care of. So all these areas are coming up. So we will have to. Only thing is that we'll have to be more coordinated, and not only the medical professions. Now it's a time. Biomedical engineers, then IT peoples, all are coordinated, and they have become the health worker, glorious health workers. So health, we were saying before, the health is a subject not only for the doctors, not only for the nursing personnel or paramedics. Now it has been widened, and the scope of the practice, good practice, has been, encompasses all the engineers, IT people, software engineers, and also biomedical engineers, everyone. Economists also, and statisticians. All these different professionals, they must come together to have some, to make it a grand success. So definitely we'll be looking for that. And afterwards, after this inauguration, as Professor Mohito said, that we'll be sitting in different meetings and to formulate our immediate goal and the next future goals. So it cannot be achieved in a day, but it can be achieved phase-wise. So we'll sit together to find out what will be our immediate goal and then the next future goals. So thank you very much for inviting me, and also I am here. I am in the process of this course of meeting. If anything comes, further points comes, we may discuss.
Thank you, sir. We will certainly progress step by step, phase-wise, with your guidance and advice. So, thank you and warm regards to you. Now,
Sujitdar video asche, Dr. Sujit Korpor's video available now. সুজিতদাকে দেখুন তাহলে
ভিডিও নেই আমি সরি ভিডিও
আচ্ছা ঠিক আছে তাহলে ওনাকে অডিওতেই করুন সুজিতদাকে অডিওতেই বলছেন
Now may I request Dr. Sujit Korporakasto, is a renowned doctor, to have some discussion on this center and your thought process. Share with us, please.
I'm audible now.
Yes.
I'm not visible though. This is not my fault. This was not my intention not to be visible. Okay. But anyway, I must say that I'd like to offer my most sincere congratulations to Honorable Vice Chancellor Professor Moitro for launching this digital healthcare technology center in his university. I think this has been a wonderful initiative that he has taken, like many others in the past that he has done. I think, I am, even though I am at the position of an administrator, but my primary background has been a clinician. So I'll be telling a few things about the digital health and the clinical practice. So there are lot of advantages that we have been talking about. But the first of all, I think, the digital or digitalization of the healthcare empowers the users, the patients, because after having worked in the Western countries for almost 30 years, what I have learned there is the interaction and the respect, mutual respect between a clinician and the patient, which has been missing here, unfortunately. Now, with when you are with a physician, and some people, like people in our country, they are so tolerant people. They have been waiting to see a physician for hours and hours together without complaining. So, this digital platform certainly will give the patient an option to talk to a physician at his convenience from a place which is much more comfortable instead of waiting in a crowded chamber. So COVID-19 has given us some positive things here, because with the scare of COVID-19, people are not willing these days to come to hospital, and they're preferring to have the discussion over video conferencing or over telephone. So that empowerment of the patient is something that I feel that has happened, and I think that could be a good thing that if we can continue there. Of course, I have done a few teleconsultations, and the kind of the information that a patient needs to put to the physician before even he has a consultation is in the history and the information about his medication, about his past illnesses, etc. And these are the most important thing for a clinician to know, because if you are getting only about 3 or 4 minutes during the consultation with the physician, a busy physician, then you don't have time to explain yourself. But with the digital platform, you have got enough time in your hand to write down everything in advance of the time that you are going to be talking to your physician. So that is another advantage that I can see, which is going to happen. And of course, the discussion in that case will be a very focused discussion without any wasting of time, both for the patient and also for the clinicians. I feel that the major advantage that the digital platform is going to give in the healthcare is in the primary care, in the preventive medicine, because it will be possible to take a large number of population, even in the rural areas, and if this platform is able to devise a center, a community center in remote location, where with some guidance from people, a large number of people can come and talk about general things, so that that the non-communicable diseases are actually taking an upper hand in the country, and the non-communicable diseases are largely preventable diseases. So that's a place that I think the digitalization is going to be of significant help. And of course, Dr. Mitra has already spoken about the electronic health record, etc., so that you have a continuity of information that you can have from your patients. But I think, this is not all that, there are also some downsides. And I think we need to know about it, because, if you know about the downsides, then we can address those issues in the future. For example, I think that being a clinician, it is very important that you have you have to, at some stage, you have got to have some tacit examination. You need to do a physical examination. I know Dr. Mitra has been talking about transferring the heart sounds elsewhere, and you can listen. But when having said that, I think it might become very important that you have to do a physical examination of a patient, and that cannot be done at this point of time. With the technology that is available now, that cannot be done without the physical proximity to the patient. I think also that, in our country, unless you have got a commune, there are a lot of people who are under the, they are not rich enough to have a smartphone or a kind of computer or something like that for them to be able to access the digital healthcare. So there is another thing that we need to think about it. And of course, there is a lack of general education. And that is something that unless there is a symbiosis between the two sides, between the people who are actually delivering the service and the one who are taking the service, unless they understand each other, then that might lead to some issues. But of course, with the improvement in the level of education, I'm sure that will probably be solved in future. I think there are other thing about this data keeping and the security of the data. I must say that data collection is one thing, but I think busy clinicians, they will have to have time to analyze the data. If you just think about the number of patients, number of tests that we have done in the recent times in COVID suspect or COVID patients, there's a huge number of data. But I don't know whether we have got enough physicians or clinicians who are analyzing those data, because that digital platform, I'm sure, will give a tremendous boost in the research work that our country generally lags behind the Western country. And there is one thing that I have got to tell, I'm going to mention about what Professor Siddiqui was talking about, the MRI, radiological diagnostic improvement and all that. But in my experience, I think there is also a downside to it, because all these advanced technologies, they actually diagnose or they detect small things, and they are called the incidental finding, the incidental hour, and they have got no connection with the clinical presentation of a patient, and that might make a patient totally out of direction as to the cause of his real illness, and they might be spending a lot of money where you have got to spend money for your treatment in a country like India. It is all right when in the Western countries, when you are insured and the state is looking after your health care. But if you have got to finding in an MRI scan or a CT scan drives away from the real problem, then not only you lose time, your valuable resources is also wasted, and we need to have need to think about it carefully. But overall, I think this initiative is a fantastic initiative, and I personally look forward to its development, its gradual evolution, and I'm sure that is going to have more. It's going to give more help, and I also must tell that this is not going to be exclusive. It is going to be complementary to what we are doing now, and if we can strike the right balance, I think the benefit will be immense. And once again, I congratulate Professor Maitra and the entire team for launching this very important, essential digital healthcare center in the university, and I look forward to be a part to the development of this program. Thank you.
Thank you, Professor Dr. Prokaisto. Through your deliberation, explicit deliberation, we have come to know about the advantages, problems, and how to overcome those problems, and the difference between the advanced countries and our country. Certainly, if we start the process, we have the able guidance and able personnels, we will certainly reach to the goal with the help of you people. Thank you, sir. Now, may I request a very scholarly, eminent scholar, Dr. Prantar Chakraborty, who is, we can say, he is one of the advisor and well-wisher of our center. He is attached from the very inception, like Professor Mitro. You please tell us your ideas, your advice, and how the center can be established in a very fantastic manner.
Yeah, thank you. Thank you for that kind introduction. And good evening to my teachers, my senior colleagues, and my friends. So Independence Day greetings. And I think what I'll try to do is give you a vision, which can be an individual as well as a collective one, because it was great to listen from you all, and many aspects of digital health have already been discussed. But first of all, let me once again, I know it sounds repetitive, but I should thank the MAKAUT team led by Honorable Vice Chancellor for thinking about bringing up such a center and naming it Center for Digital Healthcare Technology. And I will share the vision and then obviously seek inputs from all of you so that we can go ahead. So when I was thinking about this center, I thought, of a tagline, because every center usually has a tagline. So I thought that this could be a center where the heart drives neural networks. So a lot of the faculty members and students already know about neural networks. They're using it. It's only the passion which is now required to drive it together. As we said, it's an interdisciplinary initiative. It leads a lot of input, and ultimately it is patient-centric. I would not say even patient-centric, citizen-centric, because we want less patients, because we would like to look at the preventive aspect. So if the heart drives the brain, and where the brain is being augmented by neural networks, I think we'll be doing a great thing. By this time, we have already understood that what digital health is: convergence of health, healthcare, living, society, to enhance the efficiency and make, at the same time, medicine more personalized and precise. So if we look at the entire cloud of digital health, there is health in IT there is electronic health records there is mobile health, there is genomic health, games, other interoperability, imaging, and we have named our center Center for Digital Healthcare. So, when we take this entire cloud of digital health and provide our caring hands, nurture it, then it becomes the Center for Digital Healthcare. Because I think, as Eric Topol mentions, that ultimately these technologies will bring back the doctor-patient relationship and other relationships which are sadly going out because of time and other pressures. So let me share some of my dreams with you today. So if you look at this person, he appears to be very healthy. He has a very good lifestyle as we think, but we know that diabetes and hypertension are actually prevalent in rural areas also. So can we give a wearable to this person so that we can detect whether diabetes or hypertension is silently damaging his kidneys or his eyes or other organs? Because it may not be possible for him to go to a health center, stay there for a whole day for getting some tests done, collect the reports on another day, and then take an opinion. And once he develops the complications, then obviously we know that some of the complications are irreversible. So it's all about prevention, as Dr. Korpurka has said. Think of this pregnant lady in a remote village. Can we develop a wearable, say a small disc, and give it to her, and she knows where to keep it. If she detects any problems with fetal movement, she can keep it there, and that wearable through Internet of Things can immediately give a record of the fetal heart monitoring rhythm, and everything goes to the cloud. And if it is flagged, then automatic signals can go to the nearest ambulance driver, to the nearest health center, which again can flag the nearest pharmacy or the nearest blood bank, and even drones can be ready so that the samples may go if reference laboratory facilities are required. They may sound like science fiction, but I can tell you it is possible today, it is being done, and I hope we will join it. Look at this joyous couple. They have named their twins COVID and Corona. That's a different story. But can we tell them, as they have these newborns, that they do not have any genetic disorders? And it's an automated, non-invasive process. So we know that they have given birth to healthy citizens of our country. And the story starts from there, and vaccination and everything, as we were discussing under the National Digital Health Mission. Look at this lady. Can we provide certain tools, devices, IoTs, whatever, so that she can undergo screening to prevent cervical cancer and breast cancer within the privacy of her home? So you have in the audience one of the persons, I'll show his patent later on, which actually can help capture images and send it to a digital health platform for screening for cervical cancer. But we cannot stop at there. It's very important. We are saying that healthcare workers in the form of ASHAs would be going, but we cannot burden the ASHAs also. We have to make our citizens empowered, basic training, and if they can capture their images, everyone does not need a high-end phone. They can have community devices, as was rightly pointed out, and maybe my dream would be true one day. So this is the hospital where Professor Pradeep Mitra was at one time, and Professor Debasis Bhattacharya was there. Look at the queue just to attend the OPD. And I can tell you, after working in such OPDs, that most of these people do not need to come here. Almost 70% could have got their primary care at their native place, and they have to come for one investigation on one day, another for another day, single window, and then interpretation. So digital health is about primary care, but it is also about tertiary care. Look at the emergency, and this is of PGI Chandigarh. So even if you have very sincere residents, is it possible to provide optimum care in such a scenario? Unless we do something immediately to decrease the load and try to do things in a more systematic manner, we cannot provide quality of care. As was mentioned, some people sit in the OPD for 7 to 8 hours, and they lose their one day's livelihood. So even if they get a seat, it is not worth it. So I think digital tools will help us in primary, in secondary, in tertiary care, and in primary. The most important is probably preventive. Now, is it the right time? Of course, 15th August, we declare our center. So the global digital health market is valued at around $144.2 billion in 2018, grow to more than $200 billion by 2020. And now the prediction is it can go up to $250 billion because of our great friend, the coronavirus. By 2020, medical data has started doubling every 73 days. Now, who is going to keep track and who is going to analyze it? And obviously, COVID-19 has accelerated the adoption of telemedicine. So when we talk of digital health, we talk of certain eras. So if you look at the world, the age of learning was still 2010. What it is and why should we care about it? And then it was about seeding of innovation, and we call it the age of interest. That ended somewhere around 2018. We were a bit delayed in India, but we are currently in the age of implementation, age of having health IDs, age of having digital health records. How can we do it well? And we can do certain leapfrogging, which others cannot because of our inherent advantages. I'll not go into the details, but 2025 and beyond, we will be the age of scale. And that is where, we have to be ready right now. So we have discussed that the National Health Stack Strategy and Approach paper was given by NITI Aayog in 2018 for consultation. The National Digital Health Blueprint has been finalized this year. So the frameworks are there. And as we mentioned, today from the Red Fort, and this was the tweet from the Prime Minister's office, that this National Digital Health Mission will leverage the power of technology to create a healthy India. And I think, so this is the right time. So there are so many institutes of technologies, right? Why MAKAUT? You might ask me, because yeah, I have been an outsider and an insider for some time. What I feel is, other than its physical resources and human resources, the kind of programs, I've shown it earlier, that there are already 6-month certificate courses. And if you look at it carefully, so many of them are actually related to digital health. Be it blockchain technology, be it data analytics, we are talking of data security, data science with R, and even entrepreneurship skills, quality assurance, robotics. So I think that MAKAUT is well endowed, and with the help of the people who are here and who will join us in future, we can do it. But does that mean that we are just starting doing digital health? I don't think so. And I'll give you some examples. I'm sorry if I've excluded anyone, because these are the things with most of which I was personally involved. So I know about them, and I'll just give you examples. So this was an online operating system independent monitoring platform for the entire state to monitor thalassemia patients and to analyze data of screening. So whenever a citizen is screened, the data goes in there, and you can do family mapping, and you can do prenatal diagnosis there. It's working. As Professor Pradeep Mittal said, e-prescription system was adopted. Laboratory information systems have been subsequently adopted, and they have to become interoperable. If you look at the device part, so this was one device which we validated in NRS Medical College. The technology has been transferred. This is a Government of India press release about 10 days, 10-15 days back. And these were the tweets from Dr. Harshavardhan, and who has been copied, the Prime Minister's office in India. This is another non-invasive device for neonatal bilirubin estimation. And this technology has also been transferred to a 500 crore device company in India, because the Prime Minister's office was very clear, we will not give it to a multinational company abroad. So these things have already been done. And the person who is sitting there, who spoke very little, he has this patent number 199335, which I was talking about, called the DevScope, which has tremendous potential in bringing digital care to the bedside of a female for screening of cervical cancer. The government has done it, and this is the telemedicine center, which is operational 24/7 with 96 doctors, has handled so many distress calls. Because, with digital information comes a lot of misinformation. So even if there are people to speak to allay their fears, this kind of system actually works. And I think you'll see a lot of it. You know that all MBBS students and any doctor in this country who wants to practice telemedicine will have to undergo a compulsory training in telemedicine within 3 years. And that course is being developed by NIMHANS, Bangalore. In one of our webinars, we had Dr. Ashok Talukdar, who showed you cobotics. So it's not about robot alone. The data can be seamlessly transferred. So a junior person in the ICU at night, can immediately get it to the consultant with the medical charts, with the saturation, with the heart rate, and get what to do and what could be the plan. So, the consultant, the senior person need not be there all the time, but still provide the services for better quality of care. So we have done it, we can do it. What can be the vision and mission of the Center of Digital Healthcare Technology? I think quality, affordable, on demand, and equal. Because just because someone doesn't have a phone or a laptop, no. It has to be accessible, it has to be equal for every citizen residing in every corner of the Republic of India. That is our vision. Training and development of next generation healthcare ecosystem through digital platforms. Even, every Sunday we are having webinars on management of COVID from the ministry. And you can use augmented reality, virtual reality, well, people can feel now things, and it is not very far, and promoting entrepreneurship and economic growth based on digital healthcare. This is very important. We have to learn to take risks. We cannot, always think of getting a job and sitting at it and doing it. So, this is what I thought, that health to the power of nth is health. You have to, healing touch has to be there. So heal thy India or healthy India with equality, and E can be your electronic component. Conglomeration of basic sciences, legal framework, ethics, management, entrepreneurship skills, all kinds of engineering techniques, data science, and people have to understand that there is a health system which is unique for a country, which is unique for a state, and healthcare delivery methods and how we can improve upon them. So our objectives would be designed for attracting young minds. They might be nurses, medical laboratory technicians, young engineering students, even school students for hackathons, empowering existing healthcare providers with skill sets which are relevant to the rapid digital transformation of healthcare system, because whether we want it or not, it will happen. Exposure to real life scenarios, and that is one of the key points, where they can go to the institutions, can go to the fields and develop the analytical mind to augment decision-making capabilities, training in cutting-edge emerging technologies to address the current and future challenges in the healthcare system. So what will we do? Well, we can do many things, but I think the most important thing which we have already started is awareness generation about digital health and related activities. Sensitization of all stakeholders means ultimately every citizen of India. Training, and I would not call it training, it might be empowering. Continuous research to see it is deployable, feasible. Startups being incubated at our Ekta Incubation Center, consultancy for government, for others, whoever wants it. And as I told you, hackathons with school and college students, because we need those young minds, we need their innovations. We can have 3 months, 6 months, and later on advanced certificate courses for 1 year, and even 2 years programs. We can work out the details, but this is what I think would be a kind of roadmap. So we are inaugurating our Digital Health Center Q3 of 2020, and maybe in Q4 we can start offering the short-term certificate courses. Q1 2021, maybe digital along with hybrid systems, advanced certificate which can have field projects. We can have a digital health summit 1 year from now, where there can be a brainstorming of all the stakeholders, and we can also analyze what we did correctly and what we did wrong. We can start a master's course in Q1 of 2022. We can start having PhD programs, and we can have then people listening to us in terms of our patents and prototypes. So people come to know 2 years from now, yes, we are there. And ultimately, maybe Q3, 15th August 2023, we'll be proving ourselves to be a center of excellence. So I think we need all our efforts. And just to show you how a module can look like. So say a module on telemedicine. So the persons could be giving it, and there can be module A, module B, but look at the topics: healthcare data networking management system. They should know about data storage, processing, and analysis. At the same time, they should know about machine learning, artificial intelligence, and application of AI in healthcare, about hardware in healthcare, modes of communication, remote operations through robotics, maybe including drones, point of care devices, emergency critical care support, visual physical examination skill, as I talked of augmented reality, virtual reality, population resource management, economics, to see its feasibility. So I think in short, this can be a vision which can be modified, but you all, Professor Mitra showed you. So if you ask everybody who wants to change, everybody raises their hands. You ask them who wants to change, all the hands go down. And if you want someone to lead the change, you do not see anyone. I personally visualize MAKAUT in this leadership today, and I think this is the right time that we take this center forward and help the common man of India live well and healthy. Thank you very much.
Ranveer sir, please unmute your mic.
Thank you, Dr. Chakraborty, for your detailed illustration regarding the mission, vision, objectives, the mechanism in which manner we can progress, and the ultimately, what are the positive attitudes with the academics, in academics, not only in the health system, but in the academics, how it can be impregnated in collaboration with the medical practitioners, the engineers, pharmaceutical technologists, IT people, with data analytics. So many people will join hands to make it successful, to make it give a shape to your dream, and we obviously will reach to the goal, and your dream will be a successful one, not the illusion, but it will be a reality tomorrow. With this, I am once again congratulating you for the fantastic elaborations in the lucid language so that everybody can understand. Thank you, sir. Now, may I request Dr. Subhrajyoti Bhaumik to give your thoughts, your additions with the deliberation of others.
Good evening, good evening, everyone. Respected teachers, honorable vice chancellors of MAKAUT, West Bengal University of Health Sciences and Kashmir Institute of Technology, and Honorable Director Medical Education, Professor Debasis Bhattacharya, Professor Pradeep Mitro, sir, and other dignitaries present here. I think Professor Pranto Chakraborty has summed it up very well. So the only thing which I would like to add here is that MAKAUT has taken this innovative approach of bringing this digital health technology center, which can act as an important bridge between the healthcare on one side and the information technology on the other side. Because personally, I have felt that we both have worked on parallel lines, but then there has not been much interaction, I would say, on a day-to-day basis. But this definitely gives us a lot of hope that both these specialities will work together. Few things which Professor Chakraborty said is, yes, we are going to go ahead step by step. We now actually have conducted a lot of webinars to increase the awareness among the engineering students, as well as some of them were directed to the medical postgraduates as well as medical students. To name a few, there was a session on artificial intelligence in radio diagnostic healthcare, because radiology is another particular branch which is being actually revolutionized with the help of artificial intelligence technique. We have Dr. Sridhar Redla from NHS in the United Kingdom, who gave us the vision of how NHS in the UK has utilized artificial intelligence to improve healthcare in radiodiagnostics in that country. We have also had a wonderful session on clinical genetics, where we had a speaker from Massachusetts Institute of Technology, where Professor Bishash actually gave us the insights on how clinical genetics, the work she did in clinical genetics has helped improve patients in West Bengal. So I think this is going to go on, where the sensitization is going to keep on happening. Few other things which I would like to request our Honorable Director Medical Education, Professor Bhattacharya, is that we need your support, as well as Honorable Vice Chancellor, West Bengal University of Health Sciences, Professor Pandey, that we need more support in terms of getting more medical faculties to come and teach at the Center for Digital Technology, because this is something which is required in today's time, as well as I think being a pass out from the West Bengal University of Health Sciences as well as from Calcutta University, I would also like to make an appeal to my senior teachers that computer technology could be made as one of the mandatory subjects for teaching the medical students, because we have learned it on job. This could be really, really helping us to manage these data, which is going to evolve day by day. With these words, I think I really congratulate Professor Moitro, Honorable Vice Chancellor of MAKAUT, for taking this innovative initiative. And I wish the entire team, as well as the Center for Digital Technology, a huge success. We are always there, and we will be partnering for any kind of research, capacity building, as well as training initiative. Thank you.
Thank you, Dr. Bhomik. With the help of all the stalwarts, the university, under the able and dynamic leadership of our Vice Chancellor, we will certainly fulfill the mission and vision and the dreams. Dreams will come into the real sense. We will be traveling from illusion to reality, and this reality, with this idea of reality and digital health.
Okay, Dr. Chakraborty, I would like to, this first cycle is over. I think everyone has spoken. So, and Dr. Pranta Chakraborty made a, this clear descriptions of our vision and vision statement and all these things. So let us adopt this. Let us adopt this first one of this task, first action from this Center for Digital Healthcare Technology. That the vision statement as drafted by Professor Dr. Pranta Chakraborty, we are going to adopt this one for the Center of Digital Healthcare Technology. I think all of you will agree to this proposal.
Sure.
Okay, so thank you. That part is resolved now. Yeah. Second is this area of activities regarding this organization, hackathons and others, whichever has been drafted by Professor Pranta Chakraborty, that has also been we are going to adopt all these things, these proposed activities. And regarding these formal collaborations with which bodies we will have collaboration, now we will work on it further. We have certain strategic collaborations already existing with certain institutes, they will be there, but other collaborations like, this Dr. Pradeep Mitra is there. He can guide us with which bodies we can have a strategic collaboration for making these activities seamless and hassle-free in near future. And Dr. Debasis, Bhattacharya, and Dr. Pradeep Mitra, Dr. Sujit Korpurakasto, they can guide us in this direction regarding this collaboration and all these things. We have collaboration already. We are having our, this one of the center at Peerless Hospital, because we have one college there. So from that point, there is, this no problem with formal collaborations with that center. But from other centers and from not only from the state, but from other parts of the country and from overseas also, kindly suggest with which bodies we can have these types of formal collaborations. And next is if you agree, then we can take an initiative of organizing one contest or hackathon type event among the students as quick as possible to make this activity, rolling immediately. All the activity for this healthcare digital center for digital healthcare technology rolling. And there, what I propose that from IUST also the students can join from our university, IUST, and our affiliated colleges, the student can join. If we can take up this, because this time as semester examination is not going on, students of other semesters, they are waiting, and we are also not sure when this campus will reopen and all these things are there. So this time, this is the right time to engage the students in some productive and effective activities. So if we agree, then we can we can publish a notification inviting all our third years and other students from different branches of engineering to take part in this type of contest. And that can be, this monitored and managed by all these experts and who are available with us. Already, formally, we are going to have Dr. Prantoj Chakraborty, Dr. Bhaumik is also with us. We are having advisor like Dr. Pradip Mitra, Dr. Debasis Bhattacharya, Dr. Rajendra Pandey is also our honored advisor. We have this strategic partnership with Professor Siddiqui. So let us form a task force to monitor these types of this hackathon or innovative activities. But before that, we have to propose certain problems where they can work further. So let us have a set of problems, and in this for this purpose, let Professor Prantoj Chakraborty kindly take this initiative in drafting this problem statement, so that can be published with our notification. And after that, we can have another round of discussion further, maybe as soon as possible, maybe next week or maybe after 8-10 days, we can have another round of discussion. Then we can have inputs from our experts further. And then afterwards, we will publish all these things and we'll invite all the students with some prize monies and all these things, with some certificates. And so then, that will create certain level of enthusiasm amongst our students. And in the community also, the message will percolate that we have taken up certain activities, at least, for initiating these programs in digital health. And then we have to work further to seek where is the how much is the possibility of fetching government funds and grants, because national the healthcare mission has been declared. So under that, whether we are in a position or whether we are able to fetch certain government grants for this pursuing all these research activities, that also we have to explore. I think Dr. Chakraborty and from our side, Professor Pranavesh Chakraborty, you look into it. This possibility of having government grants and government supports for this endeavor, and we can also try to invite these other corporate organizations. Particularly, we are having collaboration with Wipro. We are having collaboration with Wipro, and we are having collaboration with TCG Biological, TCG the life science. Because the Chatterjee group, the Purnendu Chatterjee's group, with them we have certain partnership. We may approach to TCG Life Science Group, so for their support in this initiative. So this is another area we can work on further. And from state government side, Professor Pradip Mitra, Professor Debasis Bhattacharya, and they are there, and we can have also collaboration with Health University, because Dr. Pandey is there. If we have some formal collaboration, then it will be this effective in more handshaking and more networking with medical professionals from health universities and from our university. So we will send a proposal to Professor Pandey very soon in this regard, and kindly look into it. And that proposal will be drafting in consultation with our advisors and all these resource persons with us. We will be drafting our proposals for having some strategic collaboration with Health University. That is very much required then. And from thank you, Pandey sir. And from government departments, this health, this our health directors and health secretary. This what is the possibility of having the supports and all these things? That we do not have to worry about that, because we have these two stalwart personalities with us. So they will suggest us what to do. And
we are all with you, sir. We are all with you, and best wishes.
Thank you.
For this beautiful platform which you have initiated. Thanks a lot.
Thank you. And we are having.
We can approach. Actually, we can another institution in very near future. We can add AIMS,
right. AIMS is coming in near our main campus here at Horingata. So
very nearby to you. So that's why AIMS will be another co-partner.
Correct. That we have to explore. Correct. That's a very good suggestion. That because AIMS is coming nearby, so after setting up a center at Calcutta, we can have an extension center or further center at Haringana itself, so that we can have better collaboration with AIMS. AIMS is coming up very fast. It is going up, and every day I am looking that there is a substantial improvement in their construction. Right. So that is the nice thing, that if we can have collaboration with AIMS, then that will be a wonderful thing for us. And from Professor Siddiqui's university, we are also already having collaboration. Nothing, we do not have to take more. Professor Siddiqui is there, so whatever is there, we will do it with mutual consultation and discussion. So this is right. But now we are having a few more times. So kindly, if you want to add 1 or 2 points further, kindly do it, and after that we will wrap up this session. So kindly make one short cycle further. Professor Pranavesh Chakraborty, kindly invite 1 or 2 quick comments or rapid quick observations from all these experts in this direction.
Once again, I will be requesting Professor Mitro, because you are the pathfinder.
No, that's right. But I have already discussed with the different areas. So to start with, I told you that we will have to already Prantor has given us vision and missions, everything.
Very nice thing. Very nice thing.
Very nicely. And actually, what I told in the beginning, that we'll have to set the goal. Our objective will be some very. This will be achieved within 6 months. The target wise. So Prantor has given it a structured idea about that, how we'll proceed. So that's right. So in the different collaborative areas, as Professor Moito suggested, we'll have to fix up again from which collaborator actually what we require. So we can distribute different areas of understanding with the different collaborators. And the corporate sections also will have to venture, the corporate, other corporates. Definitely, we have very energetic people from Peerless. Subrajyoti is one of my students. And also Dr. Purokasto is there. Their medical director, Professor Kisnanshu Ray, also is there. He has joined as medical director, so we can take help of him also. So no problem. So we can start.
Thank you, sir. May I request Professor Debasis Bhattacharya to add something. Professor Bhattacharya.
I think his connectivity has lost also.
So, Dr. Rajendra Pandey, Honorable Vice Chancellor of Health University, if you can add some more things, and you can
I would
show the
suggest.
path.
I would suggest that as new education policy gives liberty for interdisciplinary approach better than before, we can design a program where such concerted effort for research as well as education will be incorporated into giving degrees which will combine both engineering and health. Program that should also incorporate where we can go for such integrations as can be done. Thank you.
Sir, Professor Bhattacharya, can you listen me?
Yeah. Am I audible?
Please.
Yes.
Now you are audible.
I think our vision and mission, everything is well set, but we have to now start working. That is most important. Let us be together, and I wish all the best to our whole team. Thanks a lot.
Thank you, sir. Thank you.
We are, Professor Pranto Chakraborty, if can this formulate all the problem statement, by next meeting we will finalize all these things, and then maybe at the second week or third week of September we can have this hackathon on the digital healthcare technology. With all our experts who are here, they can be this there for assessing and for encouraging all the students, participant students. So at next meeting, we will be focusing on this finalization of this action plan, and particularly this hackathon part. Hackathon part is that we want to start as soon as possible in partnership with Islamic University of Science and Technology and Health University. That this hackathon part will be organizing.
May I add a little bit?
Yeah, Professor Siddiqui. Yeah, I was just
definitely it was a wonderful, basically the presentation by Dr. Chakraborty about the strategy to initiate at the MAKAUT. How? So what I learned from him is that once you have the center in place and all these missions and visions are identified, which you have already identified, probably what we can learn from you is we have a similar center at the Islamic University of Science and Technology, and will look after the state of Jammu and Kashmir in terms of capacity building at the paramedic level, at the medical professionals level. I think it was a learning experience to be today on this panel, and I'm sure we will nominate somebody who will be who will be coordinating from our university side on this project, and we'll have a center on a similar lines in the university, which will cater to the needs of the state of Jammu and Kashmir. Thank you.
Thank you, sir.
Then next meeting, maybe let us take an initiative for organizing a meeting by primarily by Islamic University of Science and Technology, where we will be joining. So that will also be a good thing, because Professor Siddiqui then can bring some more resource person from your side,
right?
And we can join further. So we will listen to all your experiences and your this area of works and what are the problems and all these things. Then we can have these mutual discussions and to take our systems there for our mutual benefit.
We can also, sir, collaborate with IITs, because many of the IITs have got this biomedical, they are working on biomedical.
That for IIT collaboration, that is your responsibility now. We kindly try to establish.
And for some foreign university also, many of the foreign.
So
is also there for collaboration with, I do not know. Is there any possibility of getting some fund from WHO?
So we can always write to the WHO India office, but I wanted to actually highlight that we should include Telemedicine Society of India, which is doing a great job in increasing the awareness about telemedicine practice in India. So the
can we be a member, corporate member of this Telemedicine Society from this Center for Digital Healthcare Technology Center?
So I'm not aware of the membership rules. We'll probably take information and get back to you. Also, the National Health Authority, which is the main driver of pulling the National Digital Health Mission, which was announced by our Honorable Prime Minister. We have already made contacts with one of the senior person in National Health Authority. So I would also request if he could be included into this eminent panel and can guide us through what is the vision, the central government vision on the National Digital Health Mission.
Correct. Today it is today we are a little bit unfortunate. We cannot see Dr. Sujit Korapurokas. For a little while we could see him, but Sujit, kindly share your views.
I don't think there is much to add than what has already been said. I would like to suggest one thing, that during the process of the different stages of implementation, I think it would be very useful if we can audit development and find out what is the good thing that is happening, what is happening, which is not so good. So a continuous monitoring and auditing of the stages of development which Professor Chakraborty has outlined would be a good idea. And I think, we can, if we can share his presentation with this group, then, we'll have a more sort of, access to the ways that we are likely to progress. That's all I have got to say. But I think, everybody has been contributing very positively to this particular initiative that you have taken, and we shall do our part there, I can assure you.
Thank you. Thank you, Sujitda. Dr. Pranabes Chakraborty, you kindly explored the possibility of getting support from organizations like CIPLA and other, all these organizations, because you have numbers of students there. Ranbaxy,
sure.
CIPLA, and other,
Sure.
these pharmaceuticals, because they may be interested. Today morning we had one webinar in the future of pharma industries, and they were expressing their interest and their activities in future of in adopting digital technologies in pharmaceutical industries, all these things. That could be one of the interesting things for us.
Sure, sir. Sure. So for today, you permit to close down the meeting for today.
Yeah. Next meeting we are planning. Let us make a plan for next meeting. We'll check out with the availability of everyone. Then maybe within 8 to 10 days we can have a second round of meeting for finalization of our hackathon part.
Right.
Dr. Pranta Chakraborty asked, he may add something, the 1 or 2 points, if you want to add further, you can add, then we'll wrap up this meeting today's meeting.
No, I just want feedback, and as was rightly pointed out, that being a newborn baby, it will need a lot of care and a lot of monitoring. So obviously we would need continuous feedback, and so that we uniquely position ourselves as someone who does not talk about digital health, but actually implements it and gets the force ready for it.
Okay. There is a request of sharing the Dr. Pranta Chakraborty presentation to the participants. I think that presentation part will be there. Prem Kumar, can you give your comment how the participant can get the presentation?
Sir, we are streaming live in the YouTube, and we are providing the YouTube link, sir.
YouTube links, that will be at YouTube, and YouTube link will be given. The presentation will be at YouTube.
Or if you could, you could send the PPT presentations to our emails.
Okay.
PPT presentation, better you do one thing. PPT presentation from you can send the presentation to the email of Professor Siddiqui. He can share it then with his colleagues for there. Right. It's a very good presentation, and they also, because from Islamic University side, they also want to adopt certain things from this presentation for setting up their that center, Center for Digital Healthcare Technology there also. Getting some
I think sir Prem Kumar can collect the this thing this PPT and can send it to all the people.
Yeah. If you want to do one thing, you collect the PPT and circulate it among all the panelists first. Yes. Okay, all the panelists here circulate among them, and all the participants can get the YouTube link for check this getting this presentation.
Yes, sure, sir.
Okay.
Thank you very much. Can we leave? Can we leave
the
meeting now?
Thank you. So nice. It's a nice meeting, nice interaction. So lots of things come up.
Yeah, sure.
Thank you very much.
Thank you. I'm leaving. Thank you.
Thank you.
Take care. Take care. Everybody takes care.
Take care, sir. Take care. Good night.
Take care. Good night.
Sir, good day for us. This is very good and productive day for us. Thank you. Thank you, Sujitda.
Thank you. Thank you.
Thank
I'll
you.
leave now. Thank you. It was very nice.
Okay. ঠিক আছে সবাই এবার বুঝলেন আমরা বেরিয়ে যাই লিভ করে প্রেম কুমার তারা ক্লোজ করে দাও ওকে
Yes, sir. Thank you, sir. Sir, we have sent it
Thank
the
you, sir.
first. Yes. So we
Thank
have
you,
sent
sir.
it the feedback form. Sir.
Srinivas, sir, thank you.
Yes, sir.
Thank you. Feedback form you have to give, Prem Kumar.
Yes, sir. We have posted in the chat box, sir. Sir, and the YouTube link, sir. So both bad.
If possible,
sir.
just once you just display on the screen, then we close.
স্ক্রিনে একবার দেখিয়ে দাও স্ক্রিন पे दिखा दो एक दफा
Yes, sir. Yes, sir. Yes. All participants are requested to kindly give the feedback of this webinar session, and we have uploaded the video in the YouTube channel, and the YouTube link has been given in the display link. So kindly take the note of the links and kindly give the feedback link.
You may also give comments in the YouTube also. Certificate link. Is there any certificate today? No.
Is there any certificate?
No, sir. Today was the inaugural
program. There is no certificate today.
So they are asking actually.
They are asking. Now we can close with the permission of Shivama sir.
Yes.
Yes.
Shivama sir, shall we close the session, sir?
Yeah, sure.
Yes. Thank you, sir.
Good night, sir.
Thank you, sir.
Thank you, Soikat. Thank
Thanks,
you.
sir. Thank you.
Prem Babu, thank you.
Yes, sir.